National Safe Child Show, addressing the health, safety, and welfare of all children nationwide, because it shouldn't hurt to be a child. Here is your host, Tammy Stefano.
Hi folks, I'm trying to get my earpiece on here. Welcome to the National Safe Child Show. Thank you for joining us today. We have an incredible show. The movie VAXXED. If you haven't seen it, you need to see it. It really opens the door and exposes what's really happening within our governmental agencies and the cover-ups. And so many people believe that it's an anti-vaccine movie, and I can't stress enough after seeing it. I stressed it beforehand after interviewing the producer, but after seeing it, it's clearly not an anti-vaccine issue. And, you know, I want to stress many people, they have little to no understanding when it comes to the issues of vaccines. I want to include myself as somebody who was just in the dark, trusted what I was told, trusted the agency that said it was okay. So when I took my child to the doctors and the doctor said it's time for a vaccination, I said, okay, let's do it. Because in my mind, vaccines kept children safe, free from disease, and posed no threat whatsoever. It was only a safety measure. But in fact, what I'm finding out, what I have found out now is vaccines, like any other drug in the pharmaceutical industry, have dangers. There's many deaths associated with vaccinations. And does it really stop disease like they say? Now, it's not to say that vaccines are all bad, and it's not to say that there are good components within any specific vaccination. I think that the dispute that has smokescreened this issue really has to end between the pro-vacciners versus those who are labeled or, in fact, are anti-vacciners. And we really need to get to the meat and potatoes of it, because the bottom line is, it is about, is there a safety risk? And if there is, then we need to determine what it is. And quite frankly, the Center for Disease Control, CDC as I'll refer to it during the show, has established a guideline. So at this time, your child needs to have this, and this vaccination. And so they have specific milestones in which they mandate, if you will, infants to have these vaccinations. And this seems to be a problem. There hasn't been any research done, and we're going to find out today. So I'm going to cut through the chase. We have the most fabulous guest coming on about this issue, the founder, if you will, that pushed for this issue to be brought to the light that it is at with us now. Otherwise, we would have remained in the dark, remained ignorant. We have autism that has skyrocketed over 1 million children, and nobody has answers. We're going to bring on Dr. Brian Hooker, and as soon as he's on the line, we're going to introduce him and get this show started. Hi, Brian, are you on with us?
Yes, I am. Thank you for having me on your show.
Thank you so much for joining us. We really honor your work, and I mean, every parent, I hope I can speak for every parent that is concerned about the safety, health, and welfare of their child. We're so grateful to your diligence and your persistence being a father of a child of autism, for helping us to understand this and for navigating through this really solely. You were alone, and you just refused to accept the nonsense that you knew was being spoon-fed to you. And So I just want to honor you and thank you so much.
Oh, you're very welcome. And I wasn't alone. There were a lot of parents who did a lot of work before me. I was a bit of a pioneer in terms of my investigation, specifically for the Centers for Disease Control and Prevention. But there were a lot of parents and there were a lot of organizations, even back in 1998 when my son was born, and 1999 when he was injured by vaccines. And so, but I do appreciate it, Tammy, and it's just wonderful to be on your show.
Thank you so much. So let's start off by educating the listeners, my audience, a little bit about your background, just a brief, so that they can understand who's speaking.
Sure. I have a PhD in biochemical engineering. Before I started teaching at my current institution, Simpson University, I was a research scientist at Pacific Northwest National Laboratory, which is a Department of Energy laboratory, and I have extensive background in biotechnology and also in statistical analysis, which, was one of the reasons why I was able to pick through some of the information, some of the publications of the CDC very early on, and realized that there was a very, very strong problem, and that there appeared to be, and now I believe it's been confirmed to be, a collusion to commit fraud in the vaccine safety program itself. I'm also the father of an 18-year-old young man, Stephen, who was diagnosed with autism and also a litany of other medical and metabolic disorders that go specifically with autism and autism spectrum disorder. And I started this quest investigating the CDC back in 2001, and I am still, to this day, and will continue to investigate the CDC because I want answers. I want answers for my own family, and I want answers for families of individuals who have not already been injured by vaccines, but those families that are making vaccine choice decisions for their own wonderful children. I want to make sure that people get properly educated and that the best information is available for parents who are making medical choices for their children.
Wow. Well, I'll tell you, we want answers. We need answers. We want to give answers to the audience as to what they can do, why, through your investigation, it has come to this. If it's certain vaccines, then yes, we want them to have those vaccines. And if something is in the vaccination that is not safe, then government, step up, let the people know you have a duty, an obligation. Perhaps,
absolutely.
Yeah.
We want people to make safe choices for their children, and the information, unfortunately, regarding the vaccination schedule as it stands today, the information is woefully lacking, and the CDC has been very reactionary in the way that they study vaccines and the way that they specifically study vaccine safety. They've only looked at a very, very small portion of what is in the vaccination schedule today. I mean, children by the CDC's recommended schedule, they're supposed to get 49 different vaccines by the time they're age 6. And we want to make sure, as a parent, I want to make sure that if my son gets 49 needle sticks, I know what's going into him at each particular point in time, and it's actually good for him, not bad for him. And the onus is on the CDC to prove to us that this is something that is actually good for our children rather than something that could be harmful and damaging.
Absolutely. Mary Holland gave a presentation. I don't know if you had a chance to view that or not. Folks, if you haven't, look up Mary Holland, UN, April 26, 2016, Part 1. It is incredible. I mean, she really breaks it down that, after World War II ended and the atrocities came to light, it was implemented that people would have a choice as to what would be medically done to them. But we don't really have a choice when it comes to vaccinations. And the most precious thing to us as individuals are our children. And that right, that civil right, that liberty to parent our child and to keep our child safe according to our beliefs, unless it goes way out in left field naturally, it has been stripped. We've been stripped from this right. And it's mandated. And I mean, I have seen hundreds of cases where in the Child Protective Services world where if you don't vaccinate, you will lose your child. And every case that I've ever seen, and it's nearing 1,000, if the state intervenes for whatever reason, any referral causes the state, a social worker, to intervene, one of the first questions that they ask and demand is, we need to see the child's immunization records. When they detain children, if a parent has opted out, well, guess what? The state then takes this child on its own accord without the parent's knowledge or permission, and they inoculate these children to be up to date with the guidelines posted on the CDC, Center for Disease Control. And the parent typically finds out later after the fact, and it's too late then.
Absolutely, and again, you're referring to the Nuremberg Code,
right?
And the Nuremberg Code was put in place after the atrocities of World War II, and it basically gives human right for consent to medical treatment.
That's right.
And that is being taken away, and that is being there's a very concerted effort that I have tremendous respect for Mary Holland, and the presentation that she gave was just dynamite. But there's a concerted effort by the pharmaceutical companies, and the CDC, and the Department of Health and Human Services to take away those particular rights and strip those rights away in every of the 50 states. Right now, there are 3 states where it is absolutely, positively required. You must be vaccinated before you can attend a school, any school, unless you have what's called a medical exemption, unless you can prove that medically, beyond a shadow of a doubt, that this vaccine is going to cause injury. And so in California, the state where I live, they took away our personal belief exemption last year very, very unceremoniously, and in the face of a very staunch public opinion that people did not want this to happen. The legislature took away our Nuremberg Code rights and forced and said, public education, private education, any type of education outside of a very, very strictly defined homeschool schedule, all of those children have to be vaccinated now. And many times it's against the parent's will.
Right. And the parent has no choice.
No, you have no choice. And one of the things that having a child with a developmental issue, we are prone to have more issues with the state because we're trying to get state services, and so the preponderance, the incidence that Child Protective Services may become involved with our family is much, much greater. When my son attended a special preschool, we knew several families that had been visited, had been threatened, that actions had been taken by Child Protective Services. And my son, since his vaccine injury, is unvaccinated, and that becomes untenable and quite scary. I mean, this is my family. This is my family that can be broken up, and I'm afraid if my son was vaccinated again, he could die. He could and probably would experience more medical harm, but it could cost him his very life.
This is so scary. Something that I was looking at are these guidelines that the Center for Disease Control has established, that the medical world is following, everybody reverts to these guidelines. Is there enough research done, or is there any research done, I should say, that allowed them, or at least that they say allows them, to implement such a, over 40 inoculations 47 by the time that they're 6 years old? It's so extreme. Is there anything that you are aware of in which the CDC says that they have established these guidelines for? Or
CDC,
by?
Right. The CDC has established these guidelines based on limited testing done by the Food and Drug Administration for vaccinations. Vaccinations do not have to go through the same clinical trial process as most pharmaceuticals. Vaccines go through a very, very limited type of clinical study, and especially those vaccines that are reformulated every year, like the flu shot. And so the vaccines become once they become approved by the FDA by a very, very limited process, which is woefully inadequate. Then vaccines are voted onto the schedule by the Advisory Committee for Immunization Practices. Now, the Advisory Committee for Immunization Practices is an organization that includes university professors, government officials, and some representatives from the pharmaceutical industry. And these representatives, in the past, there have been congressional reports showing conflicts of interest on the Advisory Committee for Immunization Practices, showing that as many as 97% of the sitting members of the Advisory Committee could have gross conflicts of interest that should preclude them from voting on the infant and childhood vaccination schedule. There are individuals that have literally voted themselves rich. There's Dr. Paul Offit, who developed the Rototec vaccine for rotavirus. And when it came time to approve the Rototec vaccine or the rotavirus vaccine for the schedule, he did not recuse himself, even though he was a patent holder for that particular vaccine. Instead, he voted yes. The entire Advisory Committee for Immunization Practices placed that vaccine on the schedule, and by doing that, his institution was awarded $182 million from Merck, which wanted the patent for that particular vaccine. Dr. Offit himself made somewhere between $10 and $17 million for that single patent, and he had no business voting for that. There are so many conflicts of interest, and getting your vaccine on the vaccination schedule is big business. Getting a vaccine on the vaccine schedule could mean as much as a $5 billion market for a vaccine manufacturer once that vaccine is actually on the schedule, and individuals across the nation have to be vaccine compliant. So this is big business. This isn't something that the pharmaceutical companies are doing for the good of mankind or for the good of children to prevent spread of infectious disease. This is big business in order to protect their shareholders and maximize their profits. And I as a parent, I do not appreciate that, and I think that the system is woefully broken, not only in that case, but in many, many other instances, in the way that CDC studies vaccine safety.
Absolutely. Speaking, everything that I see that has a scent of corruption is a further look, a closer look, you see big, big, big money. So thinking in that respect, what kind of figures do you know of, or do you guesstimate exist within this vaccine industry?
The vaccine industry itself, and I am going to quote some approximate numbers.
Excellent.
I believe that the vaccine industry annual sales in the United States is $30 billion.
Wait a minute. $30 billion?
$30 billion.
And when you say sales, How do you know how that process works? Who sells to who, and how many people are on this money train, or how many entities?
There are several different entities on the money train. When it comes to childhood and infant vaccines, the biggest customer of the pharmaceutical industry is the CDC themselves. Each year, the CDC buys $4 billion worth of vaccines, which they distribute to the state's public health departments. The state's public health departments then distribute those to the counties, and then those are given through clinics and also pediatricians' offices. And so the major supplier then becomes the CDC. The CDC wants to get reimbursed for this $4 billion investment that they make every year. So from a monetary perspective, if children don't get vaccinated and vaccines sit on the shelves, then the CDC does not get reimbursed for their $4 billion investment. This is hardly an agency that should be looking out for vaccine safety. This is hardly an agency that would ever say that there was a vaccine adverse event that could potentially harm a large portion of children, because if they did, then they would be shooting themselves in the foot in terms of their own $4 billion reimbursement that they're trying to recoup every year. So it's just absolutely preposterous that vaccine safety and then vaccine uptake and compliance are both in the CDC, both in the same agency. We don't accept that in other agencies.
Absolutely.
When the Federal Aviation Administration does not investigate airline accidents, air traffic accidents, it is the National Transportation Safety Board, which is completely and wholly different than the FAA. And if that's good enough for air traffic and air safety, then why aren't we doing something similar or something even more rigorous with our own children's health?
I'll tell you, again, I'm going to use an example within Child Protective Services, which has been one of my primary focuses. Their internal affairs is within the very offices, and guess what? The public doesn't even have access to them. So when you want to make a complaint, you go to the person who you want to complain about, and they will pass it along. And it seems to be that this is the same system, and that's a big moneymaker, and this is a big moneymaker. And that has to change, because these big moneymakers have these tremendous oversights that are not being looked at except by themselves.
Exactly. There is no check and balance.
Zero.
The only people that are looking at the CDC are the CDC. In fact, I filed a formal complaint after the CDC whistleblower, Dr. William Thompson, came forward, and after I was able to compile my information, I filed a formal complaint against the CDC in what's called the Office of Research Integrity. And the first thing that happened is that the Office of Research Integrity came back to me and said, oh, the CDC is going to investigate itself. The CDC will investigate these matters internally. And guess what? When the CDC investigates itself, it finds no problem.
Of course, of course. Is that surprising to us? No.
Not one bit.
That's right.
mean, they're not going to do anything that will give themselves a black eye. I mean, they're not going to incriminate themselves. So these institutions that are investigating themselves, they take the Fifth Amendment. They're not going to do anything that would incriminate their own institution or the chief officials in the institution.
Wow, this is unbelievable. Just to give the audience, I know the audience, most of my audience will know, but for those who don't know, you had a 10-year ordeal. I want to touch now on how VAXXED the film came to be. You had a 10-year ordeal from, even a little bit longer than that, but from 2002 until more than 10 years, 2014 or 2012. Tell us a little bit about that.
Sure. As a scientist, I started investigating the CDC around 2001, 2002 timeframe, and I have a PhD, and sometimes having a PhD it's like having your and if those of your listeners that are old enough to remember e-tickets from Disneyland, it's like having your e-ticket. It gets you places, and so it got me to the place where I could talk to vaccine safety scientists directly at the CDC, and so I had no qualms about if I was reviewing somebody's information or somebody's published paper, I would just pick up the phone and I would call them.
Right.
And one of the first individuals that I ended up talking to back in 2002 was Dr. William Thompson. And
was he assigned to you, or was it just a random person?
Oddly enough, the CDC actually assigned him to me.
Okay.
And I made several inquiries with different scientists, and then I was contacted by Dr. Thompson. He said, hey, look, I'll serve as your point of contact. If you have questions about scientific studies, please, forward them to me. I'll make sure that I get you as many answers as I can possibly get.
Okay, so he was your point of contact from then on in. But
that is correct.
But something happened, so you're going back and forth with him. You're having phone conversations, right? You're having emails. You are sending letters, perhaps.
Yes, I'm sending emails. We have phone conversations, and I was not being heard. And so the questions that I started asking the CDC became more and more challenging. Right. As they were releasing data that was, at that point, they were indemnifying thimerosal, which is the mercury-containing preservative that was in many childhood vaccines, but it was phased out briefly, but now is in the flu shot that they give to infants and also pregnant women. And so I had some very, very pointed questions regarding studies that the CDC had come out with in 2002 and then in 2003, where it was obvious that somebody was committing fraud. And, as a parent, I don't use that word lightly as a scientist, yes. But as a parent, when I saw fraud, I called it fraud.
Right.
And CDC, when I saw fraud, I called it
right.
fraud.
I love that. I said right. Yeah, I agree. Fraud is fraud. There's no
right.
You can't dance around it.
No. And CDC didn't like that. And so in 2004, I received a letter from a CDC attorney, and it was basically a cease and desist letter to stop me from calling CDC scientists, and specifically from calling Dr. Thompson. And the reason that they used was that my son was participating in the National Vaccine Injury Compensation Program. We were actually trying to get compensated through the federal government for my son's vaccine injuries. And the CDC came back and said, in effect, you are trying to sue the CDC for damages, which is completely not true and preposterous. And so, therefore, we cannot answer your, for issues of discovery in court, we cannot answer your questions any longer. And therefore, the only way that you can communicate to the CDC is through the Freedom of Information Act. And so everything was cut off in 2004. The only thing that I could do was FOIA, Freedom of Information Act requests. And so from 2004 until 2013, I submitted over 100 FOIA requests. In fact, I'm still submitting FOIA requests, and it is one of the most excruciating processes I think that I've ever gone through. I also recruited some of my family members to submit FOIA requests with me, some other individuals in the autism community, and so I was being very, very persistent, and at the very beginning was being inundated with information coming from the CDC, again, that showed a commitment to cover up any type of vaccine adverse event, any type of problem with any type of vaccine in the vaccine safety studies that the CDC was doing. So that takes me up to 2013.
Wow. After you get this letter, cease and desist, we can't help you anymore, stop bothering us. You did eventually speak with Dr. Thompson again, isn't that correct?
That is correct. In 2013, some information surfaced, some background emails from the CDC surfaced where Dr. Thompson and his colleagues were talking specifically about my son's case and my son's vaccine injuries. And I was...
Wait a minute. I just want to clarify. When you say specifically, are you referencing your son by his name or a certain type of autism, or could you specify that, clarify that for us?
My son, Stephen Hooker, was the subject of these emails. His vaccine injuries and my family's claim against the federal government in order to be compensated for those injuries, that was the subject of these emails.
Wow.
I couldn't believe it.
At the CDC, they have time to write about your son amongst each other. So you obviously were stirring something up.
I was, and they were trying to use my son's vaccine injury in his case against me in order to shut down communications back in 2004. And because I was livid, then I started in 2013, when all this information finally surfaced 9 years later, I started emailing Dr. Thompson and asking him, how could you dare talk about an innocent child's vaccine injury?
That's right.
And I sent him a series of probably 4 or 5 emails, never heard anything back. But then 2 months passed, and all of a sudden I receive a phone call on my private cell phone from Dr. Thompson.
Wow. On your private cell phone?
On my private cell phone, from his private cell phone
Wow.
to my private cell phone. I didn't pick up the phone at first because I could tell it was a CDC number. I've received harassing phone calls from the CDC in the past. I didn't want to go down that road again, so I didn't pick up the phone.
When you say, wait a minute, I want to stop you for a moment. What type of harassing calls have you received from the CDC in the past?
There's only been 2, but they were anonymous harassing phone calls, basically to tell me to stop making Freedom of Information Act requests and accusing me of financial gain by making Freedom of Information Act requests. And when I repeatedly asked these individuals to identify themselves, they would only identify themselves as CDC officials. And then, at that particular point, I would end the phone call because it was quite unpleasant. I ended up tracing one of the phone calls because the phone number popped up on my caller ID, and so I traced it back, and lo and behold, it was an official from the CDC who was trying to call me. It only happened twice, but that's
2 times.
Too
That's
many.
2 times too many. That's right. You took the words out of my mouth. How dare they? And then they didn't identify themselves, so that's even more threatening.
That is correct. It was the CDC never threatened me.
Well, no, it's threatening in it of itself. If they fail to identify themselves, then that is threatening. When you speak with somebody, you call somebody's private home, and you make these assertions, you, as a government employee, should identify yourself. And if you refuse to do that, then there has to be an undertone that is insinuated, even if it is not put out there directly.
Correct. And it was, in a word, it was just creepy.
Absolutely. It's creepy to hear that.
I could not believe it was happening. So when Thompson called me then in 2013, it actually took a while. He did not leave a voicemail message. My curiosity got the best of me, so I called him and I got his voicemail, left him a message, and so it took a couple of days for us to connect. But the Dr. Thompson that I was talking to in 2013 was telling me something completely different than what he had told me in conversations earlier. In the earlier conversations, he was trying to handle me. He was trying to get me to go away. But now in these conversations that I was having off the record with Dr. Thompson, and we talked on the phone and exchanged emails. He sent me thousands of pages of records over a 10-month period of time between 2013 and 2014. Dr. Thompson was revealing the fraud that was going on in the vaccine safety program in the CDC, and he was doing it without the knowledge of his superiors. He was not in an official capacity, and he was forging a friendship and a relationship with me in order to get this information to the public.
So this was intentional. He wasn't unintentionally giving you documents that you had been requesting for over 10 years. He was intentionally saying, here you go. We've
That
done
is
enough.
correct.
We've done enough
And
to you.
There were documents that the CDC had destroyed, that he had secretly kept copies of. There were documents that he had accumulated that matched my earlier Freedom of Information Act requests that
you never
knew
received. That you never received when you filed the official document.
Oh no, I would never receive that. You've got to understand, when you go down the FOIA road, you receive very, very few documents, and usually the response time from the CDC is anywhere between 3 and 7 years. So if you submit a FOIA request, you may get the documents within 3 to 7 years of submitting that request. So it's laughable, but Dr. Thompson now all of a sudden was inundating me with these documents that I had been requesting, for the past 9 years.
Wow, you must have been beside yourself. This was finally coming to a head, and the fraud was clearly established within these documents. Isn't that true?
That is correct. The fraud was being established in the documents. I was seeing statistically significant effects that were tying vaccines to autism. They were tying vaccines to other disorders, including tics in boys, ADD, ADHD, non-organic sleep disorder, which a lot of kids with autism suffer with, among other disorders. And the links at which the CDC was going in order to get rid of this information, including out-and-out just destruction of government property, destruction of government records. There was one point that they called a meeting, and they took everything that was associated with a particular effect that involved the MMR vaccine, and they threw it away. They made a pact within all the co-authors of a particular study. There were 5 co-authors. 4 of them showed up, and they destroyed all of the data associated with that particular effect. And so the CDC was going to astonishing lengths to indemnify and protect the vaccine safety program at the expense of children who were receiving vaccine injuries from the vaccines that were being given on the vaccination schedule.
So, just to be clear and put it in a layman's form, not that you didn't, but I just need to process this because it's incredulous to think that this is happening in an industrialized, civilized country such as the United States of America. Are you saying that there were a small group of scientists that did this research, discovered that there were, in fact, dangers, and then got together, 4 out of the 5 of them, got all of the data which they had accumulated that would prove this danger, and destroyed it?
That is absolutely correct. And that's just one incidence of fraud and deception specifically around the MMR vaccine.
So there is so much talk, and it's almost, really, in my mind, it's irrefutable. But let me ask you the question. The MMR vaccine, do you believe, or is there evidence that there is a causal link to the MMR vaccine and autism?
I believe that the data show that this is supported by case study information. It's supported by case control epidemiology. The data show that there is something regarding the MMR vaccine that appears to be causing autism in specific populations, in 2 specific populations. And this was, the first one that was hidden was the effect that was in African Americans. And, that was preposterous. It was the fact that they were taking an underserved population, they saw a statistically significant effect, and they destroyed that data. And, they threw African Americans under the bus.
Absolutely. And now there are some folks that are just they're jumping on this bandwagon and saying it's not going to happen. We need to speak up now as a people. We need to speak up. Whether it's ethnic separation, it was more prevalent within the African American group of boys.
That is correct.
Of boys.
That is correct. It was of boys. The CDC, when they found the effect, they did not look at boys versus girls. I actually extended the analysis to boys because Dr. Thompson had provided all of the data for me so I could analyze them independently. And he agreed. When I found the effect for African American males, his first comment was, "Oh, you found it," and he knew exactly what I found because he had found the same effect in November of 2001. But he had, with his co-authors and collaborators, he colluded to keep that information private for now going on 14 and a half years.
So all of the boys of color that have had this MMR vaccine were placed intentionally in a line of fire. It was our government was playing Russian roulette with maybe they will, maybe they won't. Who knows?
They were 3 times more likely to get an autism diagnosis if they got their MMR vaccine on time versus those African American males that got the MMR vaccine after they were 3 years of age. On time is anywhere between 12 and 18 months of age for that first MMR vaccine.
So when you say on time, if anybody goes to the Center for Disease Control, they type in vaccines, they look at the guidelines, that's what is recommended by them. Isn't that correct?
That is correct.
So
that is correct.
If they are, in fact, if they're having these vaccines, then and they're before 3 years old, because why? They're following the guidelines that the government has set are safe. There's a high probability that they may three more times than
3 times more,
three times more than the norm, that they will get autism or at least be on the spectrum.
That is correct. That is correct. One of the things that I did find is that this was more prevalent. There seemed to be a sort of a synergism between the thimerosal, the mercury-containing preservative that was and still is in infant vaccines as well as now maternal vaccines. There was some type of synergy because those kids that got the thimerosal that were exposed to mercury early on in life were having more of a reaction to the MMR vaccine. And so there were 2 things that were really falling into line. The toxicity due to having, so much mercury exposure in infants, with the hepatitis B shot that was given on the first day of life, and then having the MMR vaccine on schedule, which is basically at 12 months age. That's when I was seeing the autism effect. And that was very, very prevalent. This was standard operating procedure in the 1990s to early 2000s. These kids were getting loaded up with thimerosal through their first shots, and then they were receiving the MMR vaccine on time. And lo and behold, we have an epidemic of autism. And it goes beyond African Americans because the CDC did another effect. They looked at kids that were diagnosed with autism, but were not diagnosed with any other type of developmental issues. Right. They termed that type of autism, they termed it isolated autism because they didn't have CP, they didn't have visual impairments, they didn't have hearing impairments, they weren't previously diagnosed with mental retardation. They were just getting an autism diagnosis, and they saw a similar effect with the MMR vaccine, and that was never reported. Wow. So it goes beyond, it's bad enough that they targeted a particular ethnic group, but it affects all children. Boys, girls, doesn't matter what the nationality, what the race. Isolated autism is shown to be in a greater prevalence in those kids that got the MMR vaccine on time.
This is unbelievable. I mean, every parent, anybody who wants to be a parent, I mean, everybody has children in their families. You should be afraid, folks, because this is real. And our government, specifically the Center for Disease Control, who initiated this study, found that there was danger and then covered it up. Is it true, or is it a rumor that they actually not only covered it up, but the way that they covered it up was they put it in bags and threw it in the dumpster? Is that right?
They threw it in trash cans.
They
threw it in trash cans, and they got rid of every shred of data. Only Dr. Thompson saved it in the background.
Now,
and so
I'm sorry. Go ahead.
He ended up saving it, and then giving it to me. And when we were on the phone, we were brainstorming back and forth. How can you legally give me this information? I don't want to put yourself in jeopardy. I don't want you to go to federal prison because you're giving me this information.
Well, it was
so
in the garbage. I mean, listen, anybody, there's garbage pickers everywhere. As soon as the CDC put it in the garbage, it was free picking for anybody.
Correct.
I mean, that's the bottom line. Dr. Thompson, he spoke with you a multitude of times, right? Over 40 times you had conversations with Dr. Thompson. He gave you this information legally. He didn't break any laws by doing it.
No.
But something, the head, the lid came off of the barrel, so to speak, the trash barrel, literally. And you came out with some telephone calls. Tell us about that.
Well, we had over 40 different phone conversations. And as I was getting this information, as I was compiling the documents that he was giving to me, as I was taking copious notes from every phone conversation, I struggled with some of the things that he was saying, not having a permanent record. Later on it could be his word against mine.
Right.
And I had no type of documentation. And so through the advice of several attorneys, some very, very good friends of mine as well, I decided to record 4 rather long phone conversations. So I had 4 rather lengthy phone conversations, and I was able to record them directly through my cell phone. And I not only recorded them, then I made a written transcript of those phone conversations. And I wanted to have that information. I wanted to have that record because I wanted to have Dr. Thompson's actual words, what he was saying, and I wanted to have definitive proof that it was being said.
Right, and not your interpretation, because we know what happens when it comes to people finding that to be credible. So
that's correct. And I did that with trepidation. I don't like, this is very, very unpalatable to me to, and I did this without Dr. Thompson's permission. I did this legally. In fact, it's illegal to do this where I live in the state of California. So I drove to Oregon. I live about 2.5 hours away from Oregon, so I drove to the Oregon border, stopped in Ashland, Oregon, and made my phone calls from there. So I would be within state boundaries where I could actually do this legally. This
is a doctor, folks, that really follows the rules, and he is appalled that not only has his family been affected, but that this is happening, and he's standing up, folks, for millions of people. And he's an honest man, so honest that he didn't want to even record somebody without their knowledge and have it not be a legal means in which he did it. I really, really do honor you. You're very blessed. Obviously, you're being used by God to get this job done. You go over You go over the state line. You record it. You didn't want to do this, but I mean, anybody would have hopefully thought to do this. It's the right thing to do. It's not just for you. It's not an isolated situation. This is for the future generation of children.
Absolutely. And I grappled with that every day. How do I get this information out? How do I, there was a tension of keeping this information private versus the greater good and sparing children, the same type of harm that, has befallen so many children,
That's right.
over 1 million children in the United States with an autism diagnosis.
Over 1 million. But those numbers, statistics are showing right now that, and you and I spoke and you said 1 out of every 2 children, 1 out of 2, has been diagnosed with some type of chronic illness. Is that right?
That is correct. 1 out of 2 and 1 out of 6 with some type of neurodevelopmental disability.
And the prediction for us in the year 2030 when it comes to autism, do you know those numbers?
Yes, this came from a researcher at MIT, Dr. Stephanie Seneff. Mathematically, if the autism rates continue to go up the way that they're going up, 1 out of every 2 children will have an autism diagnosis in 2032. And that's in 80% of all boys. 50%.
And out of the 50%, I'm sorry, go ahead, tell the audience again.
80% of all boys. So at this particular point in time, and if this comes true, you're either going to be a person who has autism or you're going to be a caretaker for a person who has autism. There will be nobody left in society that isn't affected directly, either being a person with autism or being a caretaker. There's just not enough people to go around.
We would not be aware of this, Dr. Hooker. Honestly, I cannot express enough. We would not know this, folks, without your help, without you taking such means. I'm just so grateful to you. You have no idea. You have no idea. And I know that I speak on behalf of so many. We're so grateful for your diligence.
Thank you.
We need this information, and we're just grateful and we stand behind you. Dr. Todd, you finally put this information out publicly. You said, I'm putting it out there. Because how do I get it out? How do I have people listen to me? How is this important, detrimental information going to make it to the public, to the parents, to the people? And you put it out there, and it finally became public. And the conversation was, the lid was off the trash can, and people knew. I want to jumpstart a little bit. Bill Posey, Congressman Posey, he eventually picked this up. Is that right?
That is correct. Before the story went public the last week of August 2014.
Okay.
And before the story went public, I asked Dr. Thompson if he would confide in Bill Posey. And I had worked with Bill Posey. Representative Posey we owe him such a debt of gratitude because he's done so much regarding autism in general, and also the cover-up in the CDC regarding the link between vaccines and autism. He has been a champion for the children, and I had worked with him. I'd started working with Bill Posey's office in 2011, so even before Dr. Thompson called me on the phone, I had been working with Bill Posey's office for 2 years. And in fact, there was a congressional staffer that I had known since 2005. So I made the recommendation directly that Dr. Thompson call Bill Posey's office and do the same type of data dump, just dump all the literature,
right.
Talk to him on the phone. He actually ended up meeting Representative Posey in person and filed a deposition with the legal representative there and also an affidavit. And so all of this information that was then officially turned over to Congress. He
did a deposition. I was not aware of that.
Yes, he did a legal deposition with an attorney present.
Okay, wonderful. So then, but kids are still getting the MMR vaccine, African American boys under the age of 3 are still getting the MMR vaccine, even though this literature has now come out. U.S. Representative Bill Posey has been trying to do something and has been unsuccessful. Isn't that correct?
That is correct. And
tell us about that.
Well, I want to clarify. One of the things that is very scary to me is when you look at what CDC has studied, they've studied the Marisolin vaccines and they've studied the MMR. That is it. That's all they've studied. We have so many other vaccines in the schedule. We have pneumococcal, meningococcal. We have the Haemophilus influenza, hepatitis B, the triple valent DTaP. We have rotavirus vaccine, the polio vaccine. We have so many vaccines that have been unstudied, and nobody really knows what happens especially in terms of neurodevelopmental maladies when these vaccines are given alone or in combination. And so it's not just those particular vaccines. It's not, people ask me, okay, I'm going to skip the MMR, I'll delay the MMR, and I'll be okay, everything will be fine. Really, it's a big question mark for the entire vaccination schedule. Getting back to your original question, there has been little more than a ripple in Congress since Representative Posey has gotten this information. He has disseminated this information. He's spoken on it directly on the House floor in summer of 2015. He spoke directly, and he asked specifically that a congressional committee be impaneled in order to investigate CDC, and nothing has happened. The only thing that I know that's happened in the background is that there have been 14 other representatives who have requested the Thompson documents for themselves. But in the foreground, the clock is ticking. Children are still being vaccinated with an untested vaccine schedule, and nobody's doing an investigation of the CDC. Neither does it appear to be politically palatable, given that the pharmaceutical lobby is the largest lobby on Capitol Hill.
And that, when Del Bigtree said that, boy, oh boy, it just a knot formed in my stomach, because, they're running this country, folks. They're running our government. They're running the country. There was an article done here. 51% of the foster children in foster care just in Los Angeles County were placed on psychotropic drugs. This is just, it spiraled out of control, and we the people really have to rein it in, because we're in grave danger. All of us are in grave danger. What does Bill Posey need? He needs an oversight committee in order to hear this. How can we help him?
He needs a committee chairman. He needs a committee chairman who will pick this up.
And one, they all know this, and are you telling me within the United States of America, not one committee chairman will pick up hardcore evidence that is killing children, and nobody will pick it up? I'm speaking directly to our government now.
Nobody will pick it up. I've met directly with 3 committee heads, 3 separate committee heads. Jason Chaffetz from Utah,
okay,
Fred Upton from Texas, and Lamar Smith, I believe he's from Tennessee. I'm not exactly sure. But I've met with these 3 committee heads and, talked with each one of them for at least 30 minutes, and nobody will pick this up. Other people have met directly with Jason Chaffetz, who is the head of Oversight and Government Reform, which is the obvious committee to look at this. Another individual who's a subcommittee chair, Mark Meadows in North Carolina, is currently looking at this, but he will not call a hearing. So, we've been stonewalled. We need our congressional officials to look at this very, very seriously. We have CDC officials who have been in past hearings have lied under oath. regarding the connection between vaccines and autism. They've committed perjury, congressional perjury, and it's very, very well known. In fact, Colleen Boyle perjures herself in the movie VAXXED. I mean, they have congressional testimony of her perjuring herself in that particular movie. She knew. She was one of the co-authors on the study where they destroyed the data, and yet she lied.
Why?
And yet Congress is doing nothing.
Congress is doing nothing, and the CDC is still employing Dr. Thompson. Isn't that right?
That is correct.
They're still employing Dr. Thompson. What's going on with that? What's their plan? Do you know?
I wish I knew. The last conversations I had with Dr. Thompson were in September of 2014, and I think under advice of his attorney, because the story did go public, his choice was to cut off contact with me. But before that time, I begged him to leave the CDC. I wanted him to leave the CDC because I wanted him to have the freedom to be able to go on record as to saying exactly what happened in the CDC. And instead, he's been on the inside. It's now 2016. It's almost 2 years that have passed since the last phone conversations that I've had with Dr. Thompson. And, I can only imagine, what life has been like for him. And when, as an insider at the CDC, he's not afforded the ability to talk to the press even. I've talked to major news outlets about this. I've talked to many reporters at major news outlets, and the one thing that they've said is they would cover this story and they would put it on headline news or whatever news program, and they would give it full consideration if they could get an interview from Dr. Thompson. But Dr. Thompson is unable to grant an interview, period.
Of course, and maybe that's why they're keeping him employed.
That is, he is much more malleable, much more handleable as long as he's on the inside of the CDC. As soon as he leaves the CDC, he automatically becomes a threat.
Recently, within the last couple of days, there was discussion about Dr. Thompson receiving some financial compensation, a promotion. Can you...
He did receive an award very, very quickly after the whole CDC whistleblower story broke. He did receive an award that included a monetary award, and this was reminiscent of an award. When Dr. Thompson, back when they first found this effect with the MMR vaccine, became very disillusioned and almost quit the CDC.
Right.
He almost quit. He was removed from a major meeting at the Institute of Medicine where he was planning on disclosing this effect. When the director of the CDC at the time, Julie Gerberding, found out, he was removed. He was put on administrative leave of absence. But when he became disillusioned, he was given a $24,000 retention bonus to keep him around. And then something very, very similar happened after September 2014, where he was given another award for staying inside the CDC. The nature of that award, I only have sketchy details, so I don't want to go too far out on a limb.
Yes.
But he did receive compensation, and again, based on what happened in the past, when he passed, was given a major award, $24,000, which at the time was 25% of his salary. The specific reason was to retain him at the CDC so he would not leave.
Wow. That's par for the course. Buy him off. Buy him off like we bought off, $40 billion in vaccines, and we have enough money to do whatever it is that we need to do.
Correct.
He gets an award. Where in any corporation, any entity, do you expose the wrongdoing, expose the lies, expose the fraud, and then the people that you're exposing give you an award? and give you $24,000 bonus? Where does that happen?
Well, something was...
It happens at the
CDC.
That's the answer.
Desperately wrong. Something was desperately wrong at the CDC and has been wrong. And unfortunately, it goes all the way to the top of the CDC. And it back when Dr. Julie Gerberding was the director of the CDC from 2001 to 2008, Dr. Thompson tried to warn her directly. That went nowhere. It resulted on him being put on administrative leave of absence. Now the director of the CDC is Dr. Thomas Frieden. He's no better. When the whistleblower story broke, rather than him embracing it and trying to understand what was going on, I was made the target. What the CDC did was they went after me, and they went after the fact that I had published the reanalysis that showed specifically the effect for African American males. So they went after me with a vengeance. The paper that I published was ultimately retracted under very, very dubious circumstances.
This is not surprising, and whoever falls into that bucket of smokescreen, let us help you out. Anytime that there is truth, factual evidence, and there is a cover-up, which clearly there is a cover-up. If you're taking data and which time and lots of money was spent, and you're throwing it into a trash can, we don't need to know, or really, we don't need to be rocket scientists here to know that's a cover-up. And that's
correct.
That's the reality of it. And whenever there is a cover-up, there is going to be an attack, a discrediting of the person who has shined the light. And in this case, unfortunately, but fortunately, unfortunately for a group of corrupt individuals or an entity that is corrupt, but fortunately for us, because without this, where would the children be? And where would we be? I mean, really.
It's and thank you, Tammy, for getting the word out and for having me on your show as well. I was excited to hear about your show. I knew that you have listeners all over the nation and
all over the world.
All over the world, even better.
Even better.
This is a huge cover-up. My hope and prayer is that Dr. Thompson will come forward. One of the reasons why he told me that he was staying at the CDC was to become fully vested in his retirement. I made the argument, how much is your retirement worth? How many children is your retirement worth?
How much? Well, you know what? Let's put a price tag on it, because I know that there are enough people out here. Listen, we'll make we'll get a basket going. Okay, we'll be able to give him his retirement. Come out and help us all. We are desperate, and I want to say that I honor Dr. Thompson, and I don't want to leave him out. For stepping up. I know it was difficult. I mean, I can only imagine. Staying in that employment and then feeling something moved his conscience to come out and do the right thing. It's unfortunate that it has to be that way in this day and age where we don't just automatically do the right thing. I do, you do, there are lots that do, but there's more, it seems, that do not. But he was pushed for whatever reason, and we have to really say thank you, Dr. Thompson, for reaching out to Dr. Hooker, for recognizing that what you were participating was so blatantly wrong and on every level, and we thank you. And now we encourage you to put the $24,000 aside. It's chicken feed. I mean, we've got people here in Hollywood that actors spend that on a meal, and it's really that crazy. But there's enough people out here. Gosh, we've got an organization that would take him on, and pay him, and he could sleep well, and he could be doing something that would be worthwhile to benefit children, and be able to go to work and feel good about it. I mean, that's what we all want to do. The number one killer in the world is stress. You know, it causes all such types of diseases and ailments. Why go into an area like that every day?
Exactly. And again, you know, my hope is that now, you know, 2017 is upon us. 2017 is his 20th anniversary at the CDC when he's fully vested in his retirement. It's time for him to leave.
Yes.
Even though he doesn't correspond with me, whenever I see an advertisement for a university position, and he's got his PhD in psychology, whenever I see an advertisement for a faculty position in psychology, I always zip it to him and say, okay, here's another opportunity. Come on out. Come to the outside so you can have the freedom in order to be able to talk to the press, in order to be able to bring this to light. And, you know, for heaven's sakes, turn somebody in the mainstream media. You know, these are mainstream media reporters who have wanted to interview him. Will not necessarily take my word for it. And again, it's an uphill battle because of pharmaceutical advertising dollars. You know, most of the national news is underwritten by the pharmaceutical industry, especially in non-election years.
Absolutely. I mean, don't you find it incredulous, folks, that the mainstream media is not jumping all over this? Data thrown in a waste paper basket. You know, how about touching on this? Is there any cost that we as taxpayers are incurring for this fraudulent and criminal behavior? Actions?
Absolutely. Autism costs everybody. You know, in terms of the amount of services, we have a whole generation of children that are now aging out of the system. So they're getting to the point where they're 18 years old. They're no longer the issue of the state special ed services and state services, but they're getting supplemental security income. They're getting SSI. And, you know, the SSI burden alone of this, you know, army of over 1 million children as they age out is going to be astronomical. When you look at the cost of caring for an individual with autism over their lifetime, it's somewhere between $5 and $7 million. And so if you multiply that by the millions, or you know, over 1 million children with autism, you're looking at a price tag in the trillions of dollars that is taxpayer money. You know, parents like me, we can't afford it.
And that's only if we stopped right now. That's if we cure autism right now, because we're looking at 2032, the year 2032, and it's going to be 1 out of every 2 children.
Yeah, what are we going to do? It's untenable, and it's real dollars. It's real dollars that it's costing everybody, regardless of whether they're being affected by autism or not. And you know, we can't, as a society, we cannot turn our back on these families. We cannot turn our backs on these children. You know, when you have a child with who is on the autism spectrum, many are very severe. About 25% of children on the autism spectrum are nonverbal. You know, they don't have receptive language. They don't have expressive language. You know, the parents are shut in the home because they're providing 24-hour care for their wonderful special children. You know, the fathers and mothers, you know, that are out in the workforce are working multiple jobs because of the burden. You know, it's not like we're sitting back on our elbows going on date nights.
That's right.
You know, every week.
Oh,
my wife and I. It's tough work, and it's very, very isolating.
Your life changes when you have a child and you make a plan. You have this vision. We all do. But that vision was robbed by you. It was robbed. It was robbed from you, and the fraud was implemented, and you've been duped. Your family has been duped.
And we did not know. We had no clue. What was even the components in the vaccines. Even if I received a piece of paper that I could have read, that would have told me that they would have the audacity to put mercury in a vaccine, I think that would have been a red light.
Absolutely. I can tell you, I want to just touch on that. When I was young, we had the thermometers, and at the tip, if anybody from my age group remembers, it had that little ball of mercury, right? And that's how we took our temperature. Well, parents always said, don't drop the thermometer. If you drop the thermometer and the mercury comes out, don't go near it. It was like fire. It was danger. You can die. I mean, we all knew that. And I remember seeing a thermometer drop and these mercury balls kind of scatter everywhere, and I was petrified. And now, here we are, and they are putting it in the vaccines and inoculating our children.
Right. It is going into vaccines at a...
Who would ever want that? I mean, who would say, yes, okay, knowingly say, okay, give me mercury? It doesn't make any sense. Right. Nobody would do that.
And it is far beyond the EPA safe limit for a single dose, what we call a bolus dose of mercury. They're giving these not only to infants and to pregnant women and children, but individuals that are seniors that are lining up and they're getting their flu shot at their local pharmacy. In order to metabolize the amount of mercury in a flu shot safely, according to the EPA guidelines, when an individual gets a single flu shot, they should weigh 550 pounds. Okay,
wow.
That would give them enough body mass in order to safely metabolize that 25 micrograms of mercury that's in that shot.
Oh my God!
And I don't see a whole lot of 550-pound seniors getting their flu shots.
No, nor do I. So they're placed in danger. So it isn't just the children, it's the elderly as well.
Right, and the one study, CDC would not let Thompson propose this study, and the CDC shut him down. He wanted to look at the effect of thimerosal in the flu shot on the elderly population to see if there was any type of correlation with Alzheimer's disease.
Right, I've heard that.
CDC wouldn't do the study.
Of course they wouldn't. They haven't even done studies on the vaccinations for the children who will be, running this country. Let alone they're not going to invest in the elderly who are leaving. Think about that. I mean, if they're not investing in the up and coming generations, certainly far be it for us to think that they would invest in those who have established so much for us. Who was the head of the CDC when this study was done? Do you recall?
Dr. Julie Gerberding.
Okay.
And she is now at Merck.
She is now at Merck, the pharmaceutical?
That is correct. She is head of, she's a vice president in charge of, for a while she was in charge of the vaccination division, for all vaccines at Merck. Now she's in charge of something, I think it's called like global risk communication, which involves vaccines in public health. At Merck, she left the CDC in 2008. She started her position at Merck in 2009, and she was directly involved in the cover-up. She was warned by Dr. Thompson about the problematic results, specifically in the African-American population. She chose to cover it up. She put him on administrative leave of absence. She denied him the ability to present that material in an open forum, and then she was compensated by getting a job at Merck, who is the sole manufacturer of the MMR vaccine in the United States.
The sole manufacturer of the very vaccine that she was made privy to, the dangers, and now she's going to work. She went to sleep with the enemy. She was the enemy. and now she's gone right in and she's with them. So in all essence, I mean, let's call it like it is, she's giving them, she's given them everything that she knew from working with the CDC to give them a heads up and kind of exasperate their power with this MMR.
That is correct. The very vaccine. Other things that she did.
Isn't that a conflict? I mean, I can't even wrap my head around that right now. I know that I've been with companies years ago where you cannot go to work for another company with similar interests because it's a conflict and they make you sign that you will not. Wouldn't that fall within this realm? I mean, you're going to work for the pharmaceutical company that you were once a customer of. Something's wrong there.
That is correct. And there is an obligatory 12-month period that a government official like that has to opt out. She waited exactly 12 months to the day, and then she started at Merck. But why 12 months? Why not permanently?
Absolutely.
Why can't we have government officials that are devoid of financial conflicts of interest with industry, like the pharmaceutical industry? Why did this happen in the first place?
Well, you can't be in some type of an enforcement, say like a CIA, FBI, and go and work in certain industries ever. You cannot. Why? Because it's a conflict. Why isn't this applicable when this holds so much more than than secrets? This is our whole. This is society as a whole that we are affecting. That they are affecting. Why wouldn't it fall into the same premise?
I have no idea. I mean, these are really good questions. The revolving door between the vaccination industry and the CDC is epic. Vaccine safety scientists get jobs at vaccine manufacturers all the time.
We need to stop that. We need to stop that. We need to take out, whenever there is an incentivized system, it is a recipe for corruption, collusion, wrongdoing, and the conscience of the heart being just thrown away.
Right.
We need to stop it. We need to figure out how to stop it, folks. We need to make a plan. We need to collaborate, and we need to stop that. That might put a real crux in this very fast-growing, corrupt system that's killing and harming our children, our families, and society. I have a question for you. And
yes.
We have to go very shortly here. And again, we've extended the show, folks, because what Dr. Brian Hooker is saying is so important. It has changed the course of the U.S. as we know it within the vaccine industry. And folks, him and many others that he humbly included, the parents, the pioneers, the leaders, those who recognize, we honor each and every one of you. We're in a much better place and a safer place because of you. You and I had a conversation prior to the show, and you were telling me about the CDC dumping emails. Can we speak about that a little bit?
Sure. The CDC has been involved in destruction of federal records historically.
Okay.
And
yeah,
there's very, very little enforcement regarding, what's called the Federal Records Act of 1950 as amended. But what government employees have to do is, if they think that something qualifies as a federal record, they have to preserve it. They have to make sure that there is a copy that they maintain in the records of that particular record in posterity. It
Right.
has to stay the entire time. Instead, what we had, and this was revealed to me in one of the Freedom of Information Act requests that I filed back in 2005. The then director of the Immunization Safety Office was a gentleman by the name of Dr. Robert Chen. And Dr. Chen, instead of maintaining his email traffic, both what he was receiving in terms of emails as well as replies and emails that he was originating, what he would do on a regular basis is when he would send out an email, he would make sure that he would destroy that email, that he would erase that email from his hard drive, and that it would never see the light of day. So I actually FOIA'd all of his replies. When I found this out, I said, okay, I'm going to submit a Freedom of Information Act. I want all of Dr. Chen's replies from 2001 to 2005. And the CDC came back and they said no records exist. Dr. Chen, with regularity, would erase his replies as soon as the emails were sent out.
Wow.
And then I questioned that further. I said, don't you have servers? Don't you have backup records? And the CDC's excuse was that their backup servers would only retain 2 weeks worth of backup information. After 2 weeks worth of backup information was exceeded, their servers were dumped. And so they would dump their servers every 2 weeks. They would only have a backstock of emails every 2 weeks. So anything that Dr. Chen, anything that he sent out, anything that he originated, any of his words were basically the only way that they could be exhumed was if you could perhaps get somebody who received an email from him and they were on those individuals' computers. But when you searched his hard drive, which I asked to search his hard drive, and even took the CDC to court in order to search his hard drive, when you searched his hard drive, there was absolutely no information. There are forensics that you can use in order to recover that information, even though it's erased. CDC refused, and then unfortunately the judge upheld their refusal,
Unbelievable.
saying that that was extraordinary means. But all these federal records were destroyed.
This is an extraordinary situation, Your Honor. I mean, excuse me. This is unbelievable. And why would any entity whose records are so important choose to dump their servers every 2 weeks? Folks, that in and of itself stinks. It stinks that there is something very fishy. They must be doing a lot of bad work that they need to hide. If we're talking about a 2-week period dumping, we're talking about the Center for Disease Control.
We need every single record. I worked at a Department of Energy laboratory. I wasn't a government employee, but I was an employee of a government contractor. We saved everything. We saved everything because there were FOIA requests that would come our way. We saved everything because of the Federal Records Act, and if there was a congressional request, we wanted to be able to honor that request. Dr. Chen, the reason why Dr. Chen started that practice was some of his records were very early on subpoenaed by the Department of Justice. And after his records were first subpoenaed by the Department of Justice, he started this practice because he did not want to disclose anything that he was saying. He did not want that to be subject to search by the Department of Justice. He did not want it within the reach of the FOIA, so he took the law into his own hands and he discarded these records.
And this is unbelievable, and he's not held accountable. And
No.
As a matter of fact, he's backed by the CDC for his wrong and dishonest actions. Andy Wakefield, I want to touch base quickly because we do have to go. Dr. Andrew Wakefield, we haven't mentioned him. We haven't mentioned Del Bigtree briefly, but we honor both of those gentlemen as well. But Dr. Andrew Wakefield, he wrote a book, right? Callous Disregard, Autism and Vaccines, The Truth Behind a Tragedy. And the book just got picked up by a screenwriter who wrote Shrek. Anybody who's into the Shrek scene. And they're going to make a major film on this, on his book. Are you aware of that? Yes, of course.
Yes, and it couldn't happen to a more deserving individual.
He lost his license, didn't he?
He did. He was railroaded out of the UK. He was brought before the General Medical Council, which is the governing medical body of physicians in the United Kingdom, and he was, what was called written off. Or struck off, which means that he lost his license to practice medicine in the UK.
Well, this is not at all surprising. I mean, this is what they do. They're either going to give you an award and a pocket full of money to try to shut up, or if you are not interested in any type of compensation and you won't hear of it, guess what? They're going to strip you. And they're going to discredit you like they tried to do to you. But all that does to me, and my group is say, these people are telling the truth, which is why there's so much attention on them right now.
Right.
Okay.
This is, everybody can smell a skunk.
That's right. Absolutely. Dr.
And there's a skunk-like odor coming up from the CDC because of all of this malfeasance. And, regarding Andy, he should be a national hero, and he should have been a national hero in the UK. And if there's any way that his story can get out, I've read Callous Disregard. I'm a big fan of Andy's. I enjoyed being part of the film VAXXED and being interviewed by him and Del Bigtree. Polly Tommy is a personal friend of ours and our family. I mean, she's got an affected child, Billy, who's 2 years older than my son. We compare notes, in terms of treatments, what we're doing with our children. And so I couldn't be happier for Andy on this latest revelation that his book is being picked up for a movie.
That's
I think
right.
it's just wonderful.
We think it's wonderful too, and he is a hero, and he will be seen as the hero that he is, and that license will mean nothing. Physicians, scientists, people that go into the medical field, they go into it because they want to help. They want to find cures. They want to see, they care about the health. These people that are stripped, that do the right thing, you're still staying within that attitude. You're still helping, and you're helping even more so.
Right.
Can
I mention something just very briefly? I'm so sorry.
No, don't be.
I do want to direct your listeners to another movie that was made.
Please.
Called Trace Amount. You can look it up at traceamounts.com, and it's now available on DVD, and I think there are some places that you can stream it as well. This was a movie that is about CDC fraud, and more specifically around thimerosal, the mercury-containing preservative. And I was honored to participate in both VAXXED and Trace Amounts. Trace Amounts was produced by Eric Gladen, who was poisoned by mercury in a tetanus shot that he received when he was 29 years old, and he essentially became autistic because of that tetanus shot. Yes, and it shows his recovery, and he and I are also very, very good friends. He has been working with Robert Kennedy Jr., who is also, I've had the honor of working with him as well. And they are fighting this fight as crusaders, and they have taken so many hits. Robert Kennedy has been marginalized over and over again by the press, marginalized by the pharmaceutical industry, has been attacked for his position regarding not only mercury in vaccines, but also fraud in the CDC. And so I do want to mention that to your listeners because I think, the trace amounts and VAXXED really dovetail with each other. And, I want that information to be available to the public as well.
Absolutely. Trace amounts, VAXXED, both of these films are so important, folks. It really does show that we're living in a very corrupt society right now, and the government is the leader. And we need to put a stop to it, and we cannot forget, folks, that we are the majority. If only we the people, come together and we just make a resolve that we will demand honesty, integrity, and truth within our system that affects our lives. Dr. Hooker, I want to have you back on. We are going to continue to cover this. We have some other projects that we're doing that we certainly want to speak with you about. I know that you're very busy, and if it wasn't because of your efforts, we wouldn't have these. I don't know enough about trace amounts, but we would not have VAXXED, the film, VAXXED, the movie, the name, but the film would not exist without your efforts. You, sir, are a hero, a true American hero.
Well, thank you very much. I appreciate that. You do your best for your wonderful special child.
That's right, you do. God bless you.
This is why we do what we do. We hold out hope for any gains that he can make in his recovery every day, and we work with him every day to see him make those particular gains. And we also want to make sure that other families know. When I see a woman who is pregnant, when I talk to couples that are planning on starting a family, we don't want to see them go through this. We want this to stop.
Yes, we want it to stop too, and we're going to continue, and we're going to push. And folks, all of the listeners, we need oversight to listen to Bill Posey. He has a right. He has stepped up to the plate. And how dare anybody who can give him that forum and doesn't? Shame on you. We need to get them out. And we need to put people in that will invest in the betterment of the people, not invest in the corruption of the CDC. Okay, UBN Radio. Dr. Hooker, thank you for joining us, Brian. We're honored. Really, my heart is very heavy with what you've done, and I just want to say God bless you, sir. God bless you. Thank you. Thank you.
Well, God bless you too, and God bless you for advocating so diligently regarding the safety of children everywhere.
Thank you. Thank you so much. And your son's name is Stephen, and I want to dedicate this show to Stephen Hooker, a young man whose father is brilliant, and if anybody is going to come through to the other side, it's going to be your family, sir. UBN Radio, we honor you for doing what you do and allowing this show to continue. To all of the folks out there who have heard this, who are pro-vacciners, please open your hearts and your minds. This is not a fight. The only fight that exists here isn't one against the other. It should be everybody that cares about the health, welfare, and safety of their children. Just take a look. The data is out there, even if you got to get your hands dirty in a garbage pail. Thank you, UBN Radio. This is the National Safe Child Show. Join us next week, 2 p.m. Pacific Standard Time, www.ubnradio.com. God bless you all.
Thank you for listening to the National Safe Child Show on UBN Radio. For past episodes, visit the archives on ubnradio.com. And for more information, go to nationalsafechildcoalition.com.
The views and opinions expressed in these radio programs are those of the individual hosts and do not reflect the official policy or position of Universal Broadcasting Network.